Hello and welcome. McCormack and McCants have developed a fundamental tool to guide nurses. This is called the Person-Centered Practice Framework. This framework focuses on the domains of the prerequisites of healthcare professionals, the care environment, and person-centered care processes. This video will focus on the prerequisites of healthcare professionals, including the skills and capabilities of the registered nurse. Person-centered care, or otherwise known as patient-centered or client-centered care, is widely defined and discussed through literature from around the world. There are a multitude of definitions, each a different variation of the next, but all pertaining to the key components of what person-centered care is. The key components to person-centered care include developing a therapeutic relationship based on mutual dependency and shared responsibility between the person and professional. This relationship should include open communication of knowledge, personal and clinical expertise. Shared power and responsibility will allow the healthcare professional to deliver individualized care based on the needs, wishes, and values of the patient, allowing for a focused shift from clinician to the person of whom care is being delivered, giving that person control. Thirdly, the healthcare professional must know more about the person receiving care so as to view the person uniquely and not merely as a disease or illness. The person should be empowered to make their own decisions about their health and the care they receive by being provided with support, resources, and practical expertise. Recognizing the person as a unique individual with his or her own values, beliefs, preferences, lived experiences, and needs, the health professional can provide quality person-centered care. Lastly, communication should occur between the healthcare professional, the person, and their family. The healthcare professional should communicate information about the person's care in a way that is accurate and understood by all parties.
There are many key contributors involved in person-centered care. When reviewing and synthesizing literature, three main themes can be established. These include patient participation and involvement, the nurse-patient relationship, and the context where the care is delivered. Patient participation and involvement allows the patient to participate as a respected and autonomous person. The patient has control and is actively involved in the care and treatment they receive. The patient engages in shared decision-making regarding their care with the registered nurse. Furthermore, the registered nurse supports the patient by encouraging self-management when appropriate. The registered nurse must be skilled in respecting patients' values, preferences, and beliefs. The care plan must be based on the patient's specific needs, with their care being personalized according to patients' specific requirements. The patient's physical and emotional needs are necessary to address. The patient should receive physical comfort and care, as well as emotional support and relief from anxiety. The nurse-patient relationship provides a therapeutic and healing relationship between the patient and the nurse. In this relationship, knowledge and information are shared appropriately. Registered nurses must be skilled at effective communication to ensure they are successfully providing person-centered care. The registered nurse is required to work cooperatively with the patient and their families, as well as other healthcare professionals, to ensure person-centered care is achieved. The context where the care is delivered refers to system issues such as access and barriers to person-centered care. A prerequisite of healthcare in the context of person-centered care refers to ensuring a therapeutic environment which is safe, appropriate, and comforting for patients. The registered nurse must be skilled at assessing each patient and determining their individual needs to achieve a therapeutic environment and to deliver person-centered care.
Every day, nurses are faced with challenges related to the prerequisites of the person-centered framework. Competency goes hand in hand with commitment. Commitment to your career involves continually improving one's knowledge and skills. The dedication toward furthering your education will improve your capabilities and enhance the level of care delivered to patients. If nurses are not committed to the job and have no designated time to complete mandatory CPD or lack the resources to do so, they are unlikely to utilise the time they have or make time to engage in further education. This results in the inability to meet competency standards. In most instances, a patient's main care provider whilst in hospital is a nurse. It is critical that nurses possess adequate interpersonal skills to help establish trust and build a positive rapport with each patient. Challenges with interpersonal skills include cultural differences, language barriers, religious beliefs, lack of communication skills, and lack of compassion or empathy, all of which can result in a negative outcome when interacting with patients, subsequently resulting in poor nurse-patient relationships. The act of committing yourself to work means going above and beyond normally expected behaviours and pledging to uphold high standards of excellence when delivering person-centred care. Factors that may affect a nurse's commitment to the job include personal issues, inappropriate skill mix, professional relationships within the team, and a high-stress work environment. If a workplace is at a constant high level of stress, staff may get emotionally and physically fatigued, which results in a noticeable negative impact on their commitment to the workplace, their role, and their patients. As nurses care for patients with diverse backgrounds, it is inevitable that nurses may face a moral challenge as they care for patients whose cultural or religious beliefs and values are different from their own, or if a nurse feels as though the patient's belief is jeopardizing their health or treatment. This type of moral distress can affect nurses in clinical practice, resulting in guilt, frustration, anger, and possibly influence the quality of care provided, causing personal conflict between the nurse and the patient. Knowing self is the aspect of person-centered care that ties the other prerequisites of nursing together. A strong sense of self and self-confidence will invoke positive changes in patient care and is a key component of effective clinical performance. It takes confidence in personal skills to act with commitment, consistently act in a competent manner, and express compassion, even in the most difficult situations. An individual has to have faith in themselves before anyone else does. Nurses who lack confidence in their profession may compromise the delivery of safe and effective healthcare to their patients.
There are many innovations that are used in hospitals by healthcare professionals every day that are designed to support person-centered care in the workplace. Innovation in the workplace simply means to start a new idea or take an existing idea and make it better and successful. An example of an innovation that is being used in hospitals to better patient-centered care is transforming care at the bedside. Transforming care at the bedside was implemented to redesign the working environment of nurses. This innovation was based on 4 themes: reliability, vitality and teamwork, patient-centered care, and value-added care processes. A clear example of transforming care at the bedside can be seen in a bedside handover. Handover at the bedside allows patients to be able to actively engage in their ongoing cares and to establish a therapeutic relationship with nursing staff. Nurses are expected to build a therapeutic relationship with their patients that are caring, supportive, and unbiased. Therefore, during handover in a clinical environment, it is very beneficial for both nurses and patients to be present at the bedside of each bed space whilst handing over to the new nursing team. It is evident that by doing so, it allows nurses to greet their patients in a safe setting and allows the patients to actively involve themselves in their own handover whilst building rapport with the new nursing team. It is also clear that when working with others, it is important to have communication between nurses and patients to be able to deliver the individual care to the respective person. With good communication and rapport, it allows the nursing team to be able to work efficiently and provide each patient with adequate support and care they need. It is important to understand person-centered care as a nurse, as it is a vital part of caring for every patient, and thus through transforming care at the bedside, holistically it provides each patient with the care they need. Bedside handover is a perfect example of how nurses are providing individual cares for each patient and continues to allow patients to actively engage with their cares and nurses in hospital.